We'd like to get started with our morning. These conferences, which we've been doing since 1992, this is our 27th annual conference, and it's a real pleasure to welcome you to Neuroscience 2018, Envisioning a Future of Recovery. This is a collaboration of the Department of Psychiatry at Yale University, Yale New Haven Hospital, the Department of Mental Health and Addiction Services of the state of Connecticut and NAMI Connecticut. And we all come together every year to highlight research which is coming out of the Department of Psychiatry and the Ribicoff research facilities, which I'll tell you a little bit about in a minute. And to both educate and to hear from all of you, because we're all in this together. The impact of mental illness is really just devastating in society. And it's a challenging problem at many levels, from the access to clinical services to the need to develop newer and more effective treatments for these illnesses. But you will always hear every year about the hope that's coming out of research and hopefully new opportunities. Just to introduce myself, I'm John Crystal. I'm the chair of the Department of Psychiatry at Yale and chief of the Department of Psychiatry and Behavioral Health at Yale New Haven Hospital. I like to think that we are a broader community of consumers, of treatment providers, that we're all working together on the same page to try to solve these problems, to help people get better, to help prevent the problems of mental illness and substance abuse. And while I suspect that the group attending here today really understands the magnitude of the problem of mental illness, I think together we have a challenge in communicating with society which generally underestimates the impact. And sometimes we even underestimate our impact. But I think when we think about the problems of mental illness, we should think about a problem as serious as any medical problem, like cancer. Because mental illness, at any given moment, affects 1 out of 4 families. And if you think about over the lifetime, it's actually 1 out of 2 families. Depression and alcoholism are among the most disabling medical conditions that we have, including cancer and AIDS and heart disease. Particularly for young people, mental illness is a lethal disease. So for young adults, the top 3 causes of death are actually related to mental illness: accidents, homicide, and suicide. And tragically, suicide has risen to up the list, where it is now the leading cause of death for teenagers, late teenage and young adults. And in fact, the rate of suicide is continuing to increase in society despite the best efforts that we have had to increase access and to improve the effectiveness of treatments. And so people with chronic mental illness are dying younger than their colleagues in general society. And one of the problems that people with chronic mental illnesses have is that their doctors don't take them seriously, or they don't seek help for the medical problems that they have. So that for the people having the same age and the same medical problems, they're less likely to get, say, a cardiac bypass for their heart disease or other life-extending medical procedures. Now, many people would say that the problem that we have in society is stigma. And this ad, which was developed by NAMI, always hit very hard when I looked at it. So if I said I had migraines instead of a mental illness, then could we date? I mean, right? But I'd like to use a different word because stigma is sometimes used as a term to explain why we should accept a different level of care, a different standard for outcome, a lower level of funding of research relative to other areas of medicine. And so I'd like us to use the word discrimination. Because as a society, we've come to appreciate that when there is discrimination, that there is a disparity that's perpetuated, that we need to do something about it. And discrimination in terms of access and societal support is something that we can collectively work on. And hopefully that will take care of the stigma. As I mentioned, every year we develop these conferences as a collaboration. And in a little bit, you're going to hear from Kate Matthias from NAMI, Connecticut, who's going to say a few words of welcome as well. But I want to acknowledge that we're all, some of the people who are here that are part of this partnership. Commissioner Miriam Delphin-Ritmon for the Department of Mental Health Addiction Services, who couldn't make it today, but who has been a long time supporter of both research and this conference. Michael Holmes, Senior Vice President for Yale New Haven Hospital, who is here today, but is not going to speak. But we're glad that he's here with us today. So I just want to say a little bit about research and how important it is. I always love the analogy to Thomas Edison. So Thomas Edison created a place that he called the Invention Factory, where they invented things, you know, the light bulb, all the other stuff that he invented. I could list them, but it gets long. And what made him and this group of people that he oversaw so successful was that you get a critical mass of people, like a Manhattan Project, working on a problem together. Nobody can make those kinds of inventions just by yourself, and no one's going to make fundamental advances in mental illness working all by themselves as well. It's a team effort, and you have to get people together. In the mid-1960s, the state of Connecticut created an invention factory at the Connecticut Mental Health Center, and now called the Abraham Ribicoff Research Facilities. This was a vision of Fritz Redlich, who was the Department of Psychiatry chair at that time, and Abraham Ribicoff, who was then the governor of the state of Connecticut. And what they did, which was fairly unique then, and in some ways even more unique in the current environment, was to juxtapose on the same floor people doing basic research on the brain, studying basic molecular mechanisms in animals, and on the other side of the floor, people doing clinical research, creating a clinical research unit. And this collaboration of basic and clinical researchers, which started in the 60s and continues to this day, has generated new treatments. So, for example, one of the first treatments that was ever developed based on a sophisticated understanding of brain function translated into a new treatment was the development of a non-opiate treatment for opiate dependence called clonidine, which is still used for opiate detoxification. In the 1990s, my colleagues and I discovered a rapid-acting antidepressant medication, where instead of waiting 2 or 3 months to feel better from depression, that you could give a single dose of a medication, and then within about 24 hours, if you're one of the people who responds, you might begin to feel better. This treatment, called ketamine, is now is available through Yale New Haven Hospital through the interventional psychiatry program, and Janssen is developing a drug for broader marketing. This program has also developed neurostimulation treatments like transcranial magnetic stimulation, stimulating parts of the brain with a magnet to alleviate medication-resistant symptoms of schizophrenia. Not only has this program been the discoverers of new treatment, but it's also been a conduit for new treatments coming together in Connecticut. So, for example, the Ribicoff Research Facilities, under the leadership of George Henninger, one of our senior faculty, was the first place in Connecticut to administer lithium for the treatment of bipolar disorder, or the first place to prescribe antipsychotic medications for the treatment of schizophrenia, and so on. And one of the great things about our community is that we can then take these findings, take these new treatments, and bring them in a very early stage into the treatment of patients at Yale New Haven Hospital and the other programs throughout the local healthcare system. So that people in our community are getting access to new treatments at a very early stage, which is really important. So in some ways, this is a good news, bad news moment. I've told you a little bit about exciting science, and you're going to hear a lot about that today, that we're coming up with better treatments that are safer, that work more rapidly, that work more effectively. And we have an incredible pool of talented young people that are being drawn to psychiatry. This year, 14 out of the 100 medical students at Yale Medical School chose to go into psychiatry, which is much higher than is typical. On average, about 4% of medical students go into psychiatry. This year, we had 1,400 applicants for our 16 residency slots in psychiatry. And that gives you an idea about the caliber of people that are being attracted to psychiatry at this moment. The challenge is that the whole enterprise is often at risk. And that's a really serious problem, as if the state were to cut back on its support or the federal government reduce its funding for research, then the development of these new technologies, access to treatments, and the training of the young investigators and clinicians is put at risk. So, for example, over the past year, the Governor Malloy, under his rescission powers, cut the funding for the research mission at the Connecticut Mental Health Center by 25%. And he proposed to remove the remaining 75% of the research support. He's been doing this every year for the past several years, and every year through community-based advocacy, through our legislative support, we've been able to mostly restore the funding. Every year there's been a little bit of reduction. And so this gives you a feel for how vulnerable this research mission is, which is it's so essential, it's the path to hope, and yet it's often seen as expendable. The crazy thing is that the research mission actually makes money for Connecticut. So the grants that we generate at the Connecticut Mental Health Center actually pay the state over $500,000 each year. We generated at the Connecticut Mental Health Center over $23 million in federal grants that brought all that money into the state of Connecticut at a time that the state is struggling economically. And the fact that we have so much research going on at the Connecticut Mental Health Center brought $1.2 million from the Yale endowment into support activities related to the Connecticut Mental Health Center. And in fact, Yale invested $10 million in renovating facilities at the Connecticut Mental Health Center over the past year. So you may think, as I do, that whatever money the state of Connecticut might save by cutting the support to research and training at the Connecticut Mental Health Center will be more than offset if these kinds of programs no longer are viable in that facility. Not to mention that the generation of new research findings stimulates companies to be created in the area, including Biohaven Pharmaceuticals, which is an exploding small pharmaceutical company now based in New Haven. And it's been a pathway to recruit psychiatrists who are working at Connecticut Valley Hospital and the other hospitals in the state mental health system. So those of you who've been to this conference every year for the last 27 years know what I'm about to say, which is that, number one, I hope that you'll stay informed about what's happening in the research and stay informed about what's happening in terms of the funding of this mission. You can get informed by following the Yale Psychiatry Twitter. You can get informed by signing up for the newsletter, the wonderful newsletter that's prepared by Chris Gardner, who's here, to find out about the Department of Psychiatry. And that when you're informed, that you will be part of the effort to communicate to our legislators and to our governor that research on the causes and treatments of mental illness is not expendable. It is an essential part of the effort to alleviate suffering and reduce the disability associated with mental illness. So, if we want new treatments, we're going to need to work together. We're not going to be able to do this just as scientists and clinicians because we're presumed to have a vested interest in the investment of the state and federal government in research. So we need people who care about seeing the progress to be a part of this effort. And this is one of the reasons that we hold this conference. And one of the reasons that, as you will see later, that we're going to honor someone today who understands the impact of mental illness, is communicating about this, and taking a stand to make a difference. So this is a very special day for us. I want to thank you all for coming. And I'd like to introduce Dr. Chris Pittenger, who will introduce the other participants in the program today. Thank you.